Hello everyone and welcome to Kids Brain Health Virtual Conference. I'm Nikki Lewis, the CEO of Kids Brain Health Network. I'm pleased to be launching this conference with Dr. James Reynolds, Chief Scientific Officer of the network, Elder Syexwaliya from the Squamish First Nation, our KBHN Board Chair, Jeff Pradella, and Professor Dugan O'Neill, Vice President of Research and Innovation from the network's home institution, Simon Fraser University. We'll begin the 21 Kids Brain Health Network Conference by acknowledging the land on which we gather. It is the traditional unceded territory of the Coast Salish peoples. Of note, the Kwatlen, the Katsi, the Semiahmoo, the Kikwa, the Kikite, and the Tsawwassen First Nations. We acknowledge their long-standing relationship with this unceded territory, and we pay respect to all Indigenous people in the region and from all nations across Canada. We acknowledge the traditional knowledge keepers, both young and old, and we honour their courageous leaders, past, present and future. I'd also like to acknowledge today that we're honouring our Indigenous veterans on National Indigenous Veterans Day. The conference has always served as a venue for knowledge sharing and networking with our research and stakeholder community, and we look forward to sharing this experience with you all over the next 2 days. Guiding us through the conference is a woman who wears many hats. She's a child psychologist and an award-winning author who for the past 15 years has developed programs that bring a relationship-focused and trauma-informed perspective to all those individuals who support kids and families. It's my pleasure to announce that the Master of Ceremony for this conference is Dr. Jody Carrington. With Dr. Carrington, we'll explore how meaningful change for children with neurodevelopmental disabilities and their families continues to come about through partnerships and innovation. Our Programming and Logistics committees have worked tirelessly to bring you this conference today, and it's jam-packed with exciting sessions. I hope you'll enjoy learning and sharing from these sessions as much as we have had in creating them. We're excited to share this journey with you, and I'm now going to pass this over to our Chief Scientific Officer, Dr. James Reynolds.
Thank you very much, Nikki. Hello, and again, welcome to the Kids Brain Health Virtual Conference. My name is James Reynolds, and I'm the Chief Scientific Officer of the Kids Brain Health Network. And I would like to add that I am situated, or coming to you from the traditional lands of the Anishinaabe and Haudenosaunee peoples. And I am proud to live, work, and play on these lands. KBHN is a national interdisciplinary network of researchers, clinicians, partner organizations, and families dedicated to mobilizing and implementing new knowledge to improve the lives of children living with neurodevelopmental disabilities and their families. KBHN is achieving this goal by engaging with partners through multi-sectoral initiatives focused on knowledge sharing, resource development, and building capacity for enhanced and improved systems of support for children and families in diverse communities. Since its inception, KBHN has dedicated itself to finding innovative solutions for 3 major challenges. First, the gaps in the early identification of children with a neurodevelopmental disability. Second, the lack of appropriate evidence-based interventions for these children. And finally, the fragmented systems of support available to families. Our vision is that all children with a neurodevelopmental disability will enjoy quality of life, inclusion in all aspects of society, and reach their full potential. This year's conference theme, Realizing Change Through Partnerships and Research Innovation, will celebrate and explore the many ways in which KBHN and its partners are working together to ensure better outcomes for all children with a neurodevelopmental disability. Over the course of this conference, you will hear from researchers, trainees, partners, parents, and family members, who we hope will not only inform and inspire you, but serve as a reminder of all that remains to be accomplished. We are grateful for your attendance, participation, and continued engagement today and tomorrow. I also look forward to learning with you and from all of you. Okay, so we've had a bit of technical difficulty in bringing Elder Syexwaliya on the line. So I'm going to pass now the podium, the virtual podium, over to Professor Dugan O'Neill at Simon Fraser University to give some opening remarks.
Thank you, James, and thanks, Nikki. It's a privilege for me to live and work in the beautiful unceded territories of the Tsleil-Waututh, Coquitlam, Squamish, and Musqueam nations, but it's 7 a.m. in Vancouver, and I'm coming to you from my home, which is on the traditional unceded territories of the Syexwaliya people. In spite of the fact that it's early and it's dark, I'm very happy to be here this morning to welcome you on behalf of Simon Fraser University to the second annual Kids Brain Health Virtual Conference. SFU is very proud to be the host institution of Kids Brain Health Network and proud to be a member of the network, and that it reflects and that's SFU's strategic research priorities to improve health across the human lifespan and to support the translation of knowledge for the greatest social impact. And this partnership also exemplifies SFU's commitment to engage with communities, to advance and share knowledge. I'm delighted to see so many post-secondary and healthcare partners as conference presenters during this conference. Through our collaborations, we'll be able to provide healthcare professionals, policymakers, caregivers, and families the necessary tools and information to promote earlier identification, better treatment, and optimal outcomes for children and youth. And as a parent and educator myself, I can't imagine a more worthy endeavor than helping young people thrive and achieve their potential. So I wish you a productive and inspiring 2 days of learning, collaboration, and networking. Thank you all for joining us this week. And some special thanks to Nikki Lewis, James Reynolds, a talented team at Kids Brain Health Network, and the conference organizers for their hard work putting together this conference. And with that, I'll pass the virtual floor back to Nikki and James.
Thank you, Dugan. Thank you for those warm remarks. And KBHN is delighted and pleased to be hosted at SFU, and that alignment with our community engagement. The community engagement spirit is with us all. I'd like to take now this moment to introduce our board chair, Jeff Pradella. Jeff became our chair at our September AGM this year and has been very active at KBHN since joining the board and served as vice chair before assuming chair. So I pass the podium over to Jeff. Thank you.
Thanks, Nikki, James, and Dugan for your opening remarks. I'll start by speaking to you today from the traditional Treaty 7 territory of the Blackfoot Confederacy, which makes up the Siksika, Kainai, Piikani, Nakota, and Tsuut'ina nations. I'd also like to acknowledge this territory as home to the Métis Nation of Alberta, Region 3. As you've heard, my name is Jeff Pradella, Board Chair of Kids Brain Health Network, and I'm pleased to join my colleagues in welcoming you to this year's conference. In Canada, 14 to 17% of kids aged 4 to 14 have some form of neurodevelopmental disability. As James has talked about, many of these children face barriers to early identification, intervention, and support. Since 2010, KBHN has dedicated itself to developing an innovative solution to addressing these barriers. To achieve our vision, we've engaged and collaborated with numerous community groups, nonprofit organizations, industry, parent, clinician, health professional, and both provincial and federal governments to help innovative solutions and services that focus on these major challenges that are critical across virtually all neurodevelopmental disabilities. In doing so, KBHN has been able to build capacity and engagement of frontline community agencies, support opportunities for researcher community, and scale interventions and programs for children and families. The 2021 year brought with it some amazing growth in our network. This past year, we saw the support and training of 209 highly qualified personnel, the creation of a trainee-led leadership group, the Policy Advisory and Research Training Committee, led by 14 trainees in our network, an astounding 337% increase in the total number of KBHN partners, and over $4 million in financial contributions, plus the creation of a new sustainability committee of the board, which is guided to ensure the continuation of KBHN-funded projects beyond the close of Cycle 3 funding. Achieving these key performance indicators is a testament to the hard work, commitment, and dedication to our vision of everyone involved with KBHN. As Nikki and James mentioned, this conference will look at the many ways that we as a network connect with one another. Our conference organizers have put together an exciting, informative, inspiring, and thought-provoking 2-day program involving speakers, researchers, trainees, partner organizations, and families. Your participation and willingness to share your time is both valued and appreciated. So please feel free to ask questions, engage in our chat forum, and connect to our feed loop platform. And as always, thank you for your continued support. I'd also like to thank our host institution, Simon Fraser University, for their conference sponsorship and continued and excellent support of KBHN's initiatives. And with that, I will pass the mic back to Nikki and James to introduce our MC.
Thank you very much, Jeff. Sorry, Nikki, I can't remember which one I was going to introduce Jody. But since I'm talking, I guess I'll do it. So it gives me great pleasure to introduce once again the MC who will guide us through the next 2 days, Dr. Jody Carrington.
Well, good morning, KBHNers. Listen, I am so excited to be here today. I can't even tell you. So thank you, Nikki, James, Dugan, Jeff. We are hoping that Elder Syexwaliya will still be able to join us today once we work on our technical issues. The warmest welcome. Thank you so much for that. I am indeed Dr. Jody Carrington, and I'm so proud to host the 2021 Kids Brain Health Network virtual conference. I am a child psychologist by training, and I am now currently, I spent 10 years at the Alberta Hospital on a psychiatric unit with kids. And I learned the most about relationships and connection. I spent a lot of time studying mostly in Saskatchewan, and I did my residency in Nova Scotia, where we spoke a lot about behavioral interventions and how we sort of alter the behavior of kids, and particularly when they struggle. That became something that just didn't make sense to me, to us, to the team that we were working with. And so we started to focus a lot on relationship and connection, and how you can't tell kids how to be great, you got to show them. And I was so excited to hear about, the theme of this year's conference, because I think it makes the most sense to me. After we had 3 kids of our own, I have a 10-year-old, and then I apparently got it so right with that one. I got twins at 38 years old. It's fine. It's good. And we decided to move to a small town in Alberta, where I started a private practice and consulting primarily to educators about how to work with kids who struggle the most. Those babies, I think, are my favorite. And I wrote a couple of books about it. One is called Kids These Days, and it became a national bestseller, talking about what I think is one of the most important things in the work that we do, relationships and connection. And I think that when I look at the list of speakers that you're fixing to set in with today and tomorrow, I can tell you that some of the most innovative and cutting edge research is coming out of this, this network that I'm so happy to be a part of today. And I cannot wait for you to sink in. The poster sessions are phenomenal. The speakers themselves, who I'm so excited to introduce you to, will really, I think, allow us to start to think about some things in different ways then. And I think that's really the point of this innovative conference. The theme this year is realizing change through partnerships and research innovation. And for me, this idea of partnerships is so critical. We were never meant to do any of this alone. And the more connected we are to the kids and families we treat and we try to understand and support, that really is the answer. And we've known this for a very long time. And I think in this age of disconnect, particularly during COVID, we've learned that we need each other now more than ever. And so what does that look like? What are some of the sort of the latest interventions when we speak about kids and families who struggle the most? How do we stay the most connected? So this virtual annual event celebration and exhibition of all of the achievements that Kids Brain Health Network and its partners have made to further ensure better outcomes for kids with neurodevelopmental disabilities. We hope that the next 2 days will help you make new connections, relationships, and of course, new partnerships. As we begin today's conference, we just want you to know that you can drop in and out as often as you like, but don't log out for too long because I don't want you to miss some of the fantastic lectures that they have lined up for you. This platform feed loop, I know there's been a lot of, I think, you can click on learning your ways to sort of maneuver around it, but really check out all of the interesting pieces that sort of are going to allow us. There's a gamification part that we can talk about a little bit more as we navigate here. But I think most importantly, I want to hear from you today. You'll see in the chat, which is on the right-hand side of the platform here. Feel free to engage, answer some of the trivia, take part in the polls. There is phenomenal prizes. There's iPads and coffee cards, and there might even be some books like one that I wrote called Kids These Days, and another one I wrote called Teachers These Days that are up for you to win. And please submit your questions using the Q&A. I would love to make this, I think, one of the most unforgettable virtual conferences over the last, I think, 18 months since this pandy. I don't even want to call it a pandemic anymore. I call it a pandy because it's really starting to tick me off. I think that we've learned so much about, the importance of connecting virtually on these platforms. And I think if I take a look at what the Kids Brain Health Network has really put together for you today, really make sure you spend some time navigating and connecting with people here on the platform today, because I think it is one of the most important ways to even while we sit in our own offices, we can stay connected. And I currently do live, work, raise our babies on Treaty 6 territory and Treaty 7 territory, which is in Alberta. It is home of the Tsuut'ina First Nation, Stoney Nakoda, the Métis Nation Region 3. It is my honor to come to you to present everything I know, where I was so privileged to raise our babies on the land where so much sacrifice has been raised. And I really want to tell you of our sponsors today. There's a massive group of people today who have really come together to put this together. Simon Fraser University is one of the platinum sponsors, is the platinum sponsor. And there's a couple of silver sponsors who we are just so honored to sit with today. The Canada Fetal Alcohol Spectrum Disorder Research Network, CanFASD, is a silver sponsor, as is Queen's University, the Health Sciences Division, they're a silver sponsor. The Azzarelli Foundation is one of our silver sponsors as well today. Now, Children's Hospital of Eastern Ontario, CHEO, of course, is a bronze sponsor, as is the Family Institute of BC. We have two supporting sponsors, the Kids Inspectors Alliance, CASDA, and Holland Blue Review Kids Rehabilitation Hospital is also one of our supporting sponsors. So thank you so much to each of you for, believing in this network and all of the greatness that is fixing to happen here today. Again, to SFU for being the platinum sponsor. They are the exclusive sponsor of the Fraser Mustard Lecture, of the gamification activity where you'll find trivia, sort of sprinkled throughout this today. And they're uniquely visible in the platform virtual lobby as you navigate today. I really want to talk about the panels that you're going to sit with this morning. Dr. Paige Church, come on. I had some time just to meet her briefly this morning, but I have spent many, many moments learning about this phenomenal woman. She is this year's Fraser Mustard Lecturer, highlighting the need to change the culture of medicine to one of respect and connection. She's going to speak to us a lot about ableism this morning. And then new to this year is hashtag how not to do patient engagement. What really happens when patient and family engagement doesn't go according to plan? And listen, I think we spend a lot of time trying to make it right, and we don't spend a lot of time talking about what happens when it doesn't go well. And so holding space, during this day to really do that, I think is going to be amazing. All attendees are encouraged, anybody watching today, is to have your say in this process by joining in on the discussion on Twitter to create a positive future through a hashtag that we're using called Building Back Trust. So please engage on your Twitter platforms. We'd love to see you do that. The poster session, which is blowing my mind, is set up like booths. When you enter it, you'll see the navigation menu is on the left left-hand of your platform today, it's set up like booths. And so you can sort of enter into each of those booths, virtually walk around. You can network with the poster presenters. They're there waiting to talk about all the amazing things and research that they've been doing. So there's also then a networking space to engage with with each other and the presenter. So please take a look at that. And again, I've spoke with everybody here, all of our partners this morning about, in case you missed it, there is a gamification aspect to this year's conference. And so many people I know in this space of research and doing great things are competitive. And so you'll see codes settled in throughout the platform today. There's a leaderboard that you will find. And if you earn enough points, you can cash in for big prizes, including iPads. So take a look at that. By answering trivia questions, which you can find on the Kids Brain Health Twitter page, as well as participating in the scavenger hunt happening across the platform, you can earn points to win some of those awesome prizes. And again, all of that can be found on the gamification tab, which is on the left-hand part of your screen. The other thing that I really want you to know is that when we navigate between each of our speakers today, it actually is going to require you to click on the left-hand side each of the presentations. And so they don't automatically pop up. We want to make sure that when you're ready, you can view them. So once they've gone live, you can click to the left-hand side and you will see each of the lectures coming up. So we're going to, I think, shortly step into a break, but I want you to just notice, again, back to the platform, back to the conversations, engaging with the people today. Use this as your opportunity. We started in the chat this morning, just really outlining where people are coming from, and you'll see people are joining us from around the globe. And there's particularly, a lot of people, I think, we've got it coast to coast. So tell us where you're joining us from. Tell us, what you're, engaged in, what the best parts of today are. If there's anything that you need from me or this team throughout today, put it in the chat, pop it in the question and answer period, and we will go from there. We're at any point, I'm excited to hear from all of you as well. So to do is just jump into our transition, and we're going to just pass that over so we can take a break, fill up your coffee. When we are ready to start again at the next session, I will jump back on. You'll see my face before I introduce the amazing Paige Church, who's going to join us next. So I'm going to throw it a break, fill up your coffee, and I'll see you back here for a 10:35 start.